This conference will now be recorded.
Hello everyone. So a very good evening to all of you. I'm Dr. Gitika from Rayzacademy, and today we'll be covering uh, one of the recalls, which is a very important recall, in fact, from the post-operative module. So, but I need one volunteer from amongst you. So anyone who wants to do the station can just let me know. Rikita, Manikam, Ash, any one of you who wants to do it?
Okay, ma'am.
Okay, Manikam, you'll do? Good.
Yes.
Okay, so you will be given 2 minutes for the reading and 10 minutes for the performance, okay?
Yes, ma'am.
Okay, dear. Your time starts now.
Yes, ma'am. Next page.
Yeah. Your time starts now, Manikam.
Yes, ma'am. Hello, I am Dr. Monicam. Am I speaking to Mary Smith? I'm
Yes,
doctor on
doctor.
call.
Yes, doctor. This is Mary Smith.
You are 22 years now.
Yeah, I'm 22 years. Yes, doctor.
How do you do now, Mary? Do you have any fever or pain?
No, I'm doing fine, doctor. I'm recovering very well after the surgery, and
Is
I
there
really
any
hope that I'll be discharged soon.
is there any shoulder tip pain? Nothing.
No, nothing.
Any pain around the that is the site of a keyhole surgery?
No.
Did you pass urine?
Yes.
No cough, nothing.
No.
Did you sleep well?
Yeah, I slept well, doctor.
The antibiotic injection or tablet you have received, no?
Yeah, they are giving some medications, some painkillers they are giving, and I'm very comfortable.
So I want to go through your notes also. And
Okay.
did anybody meet you and explain what has happened in the surgery?
No, no one came till now.
Um, Mary Smith, shall I ask a few questions to know about your previous history?
Yeah, you can.
How long you had the pain?
Actually, I had pain for around a month I was having, and 2 days before it became very severe, doctor. So I rushed to my GP. He said that a scan needs to be done. I was sent to the hospital. They did a scan. They told me that there was some cyst in my right ovary, and which has twisted. So they need to remove that. So that surgery was done. I think they have removed that cyst from my ovary now.
Did you have any vomiting?
No,
No. Do you have any medical condition for which you are treated by a GP?
no,
Any allergies?
no.
Hmm. Uh, what about your periods? They are normal, no? Is there
My
anything you
periods were
want to
not.
tell me?
No, no. Last period
Hmm.
was 15 days back and they are
Hmm.
regular.
Hmm. Uh, do you have one intrusive question? Do you have any partner now?
I have a
Are you
boyfriend,
with
yes.
someone?
Yeah.
Are you studying?
Yeah, I'm in the university, just
Ah,
gave my exams, yes.
okay. I want to discuss one important thing to you. I apologize to you that during the surgery, the right ovary had a cyst called dermoid cyst. That is the component of uh, the skin during our embryological period when inside our the mother's tummy, it has formed a cyst in the ovary. So that has developed big and it has got twisted. And during operation, it was black and it appeared without any blood supply and it could not be revived. It, it is not safe to keep it inside. So the consultant and the other doctors decided to remove the ovary along with the tube as both were uh, dead. I'm sorry to be the bearer of this bad news. And the specialist
What,
nurse is with
doctor?
you. The specialist
They
nurse
have
is with
removed
you to
my
support.
ovary? No, 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 doctor. How can they do that? They told that they'll be removing just the cyst. How can you remove one's ovary without just informing?
Your concern is valid. Even if I am in your position, I'll be talking like this only. But keeping the ovary, it will become a focus of infection and it will be endangering your life. For that sake only, the whole ovary has been twisted and it has lost the blood supply and it has become dead. That's why it was removed. Um,
But why wasn't it told to me earlier? Why they didn't discuss that this thing can arise during the surgery?
I'm sorry, it should have been discussed with you. There is a chance of always in any dermoid cyst or any cyst which has been twisted, there is a chance of loss of blood supply to the ovary. It should be, I really feel sorry for the same. I apologize to you. It should have been informed to you. And they never expected that the whole ovary will be lost also. That's why they should not have told, I think.
But
Anyway, I'll discuss
doctor,
with
you
the
can
consultant.
understand I'm so young. How will I get pregnant? These people, they have removed my ovaries. I really don't know. How can I get pregnant in future
I,
now?
I'm able to see your distress. I'm able to understand everything. But one ovary is enough for getting pregnant. Um, you're having the left ovary and tubes are healthy and the uterus is normal. This alone is enough to get pregnant. With one ovary alone, you can get pregnant. Do not worry, Mary. and we have made an instant report also, as it has gone into gangrene. It has been removed, and this it has been informed to the risk management team, and they will conduct a investigation, and their findings and their decision will be communicated to you by my consultant. My consultant will come and she will explain everything with the reports. I'm really very sorry to be the bearer of this news. This has been done as a part of protocol only.
I hope it was not a cancer, doctor. That's why they have removed my ovary.
No, it is not a cancer. The dermoid cyst is a benign condition.
What do you mean by benign, doctor?
Benign means it is not a cancer. It is just a swelling with the hair and the parts of the developing from the skin, like bone, thyroid tissue, and the sebaceous material, that is the oily matter produced in our skin within the gland called sebaceous gland. These material only will be there. So what have been done is being done correctly, but I do feel they should have, as you were in a hurry to save your life, it was taken for a quick surgery to relieve your pain. They should have informed previously also. I do feel the same, but I will ask my consultant. She'll come and explain to you. I'm sorry to be the bearer of this news. Will be treated with antibiotics, and that has been sent for lab test. And your one ovary is adequate for getting pregnant. Your fertility will in no way disturbed. And I want to tell you one thing also. This may there is a chance of a cyst occurring in the other tube is also there in 1 in 10 women. So if you develop any pain in the left side of your tummy, you should come earlier, so that you should not go for torsion like this. If it is a very small, that can be tackled in an earlier way, so that your fertility will not be affected. There is a very rare chance, but I'm not telling this to scare you, just to make you know the fact I'm telling. You will be given all the details and the antibiotics, everything will be given to you. Everything will be documented in the discharge summary. This will be communicated to the GP also, and you'll be given the antibiotics and painkillers for the duration, proper duration, for about 5 to 7 days, and you'll be coming for follow-up after the result of the result of the tissue which has been sent for lab test, and that will confirm you that it is not a cancer. 99.9% it is not a cancer. The report will be discussed with you.
And when will I be discharged from here?
You'll be discharged third day. This is the second day. Tomorrow most probably you'll be discharged. Before that, consultant will come and talk to you, and we want to discuss the fact with your partner and your family, and we have discussed this among our
Time is over,
operating team also. Thank you. I will give you the patient. Thank you. Thank you, ma'am. Thank you, ma'am.
Okay, dear. Well covered, Manikam. I want that flow of sentences can be modified here a bit. Okay. Otherwise, the whole concept as such, you covered almost everything. This was not known to her that that oophorectomy has been done, and this was not even discussed. So this is a breaking bad news for her. So always try to do such kind of stations in a breaking bad news manner. Okay, so you can ask her who is there with you. Is there someone there with you? Do you want my staff to be called once I have something important to be discussed with you? Do you want my staff to be with you once I'm discussing? So just warning shots can be given before you told that what exactly has been done for her. The rest of the questions, well, you addressed it all well. Only the thing is that yes, you covered it in time. This was a small station, and you covered well in time. That was a good point. Your communication was good. Information gathering, yes, it asked her about her post-operative recovery, which is the first thing which we are doing whenever we are dealing with any post-operative case. So that was also you addressed whether she's comfortable to talk to, whether she's having any symptoms, and what were the events which led to this surgery, what exactly happened with her. So that also you asked. You can even ask her about any red flag signs, whether she had before she came to the hospital, like any weight loss or any loss of appetite. Though on gross examination it is a dermoid cyst, but
Okay.
the exact diagnosis, the definitive diagnosis will be there only after we get histopathology. So
Okay.
once she asked, is it, I hope this was not a cancer. So just tell her that though by grossly looking at the cyst, and it appeared to be an innocent growth on the in the ovary, but
Mm.
yes, this has been sent to the lab, who will be doing further studying it, and they'll be giving us the reports, which will be available to us in a week's time, and then this can be discussed. Though by your reports which we have, and by during the surgery, it appeared to be an innocent growth which was arising. Her fertility issues also you addressed very well. So let me do the station for you. Overall, very nicely covered, Manikam. Keep on
Thank you.
practicing, keep on
Yes,
doing
ma'am. Thank you,
stations,
ma'am.
and definitely you will improve day by day. Okay.
Yes, ma'am. Thank you,
So
ma'am.
let's see the key. Thank you, Manikam. Thank you for participation. So the key, as I told you, whenever we know that the patient is already admitted with us and we know about the patient, we can directly address the patient by her name. Hello, is this Mary Smith? May I confirm your age? How do you like to be addressed? I understand, Mary, that you had procedure for cyst in your ovary. I'm here to debrief you about the procedure you had. Is this the right time to talk to you, Mary? Do you have any pain? Assess the need for painkillers. Assess that she is not in pain. And if she is in pain, you can ask your staff to give her painkiller after checking her allergies. So, Mary, how are you recovering after the procedure otherwise? Did you open your bowels? What about your waterworks? Do you have any pain in your legs or chest? Have you moved about? Have you noticed any bleeding or discharge? Sorry to recall back your memories, Mary. I know that that was a difficult time, but can you take me through the events which led to the surgery? Then she'll tell you what exactly happened with her. You can address some risk factors since this is an ovarian growth, so definitely red flag signs can be asked in information gathering. Any weight loss you noticed? Any change in the appetite? Can you tell me more about your periods? When was your last period? Sorry to ask few intrusive questions. Are you with someone? Are you sexually active? Have you ever felt any pain during sex? Have you or your partners been screened for any sexually shared infections? And have you ever been pregnant before? What are your wishes for future pregnancies? And what kind of contraception have you been practicing? Are you seeing your GP for any other medical reasons? Any surgeries apart from the surgery which you had just now on your tummy or down below? Are you on any long-term medications? Any allergies do you have? You can skip here blood group and Genova witness because this is a stable patient. So no need to ask about blood group. But yes, you can always address her weight to height ratio, which puts her at increased risk of DVT and pulmonary embolism. So are you aware of your weight to height ratio? Any family history of concerns? Few personal questions, Mary, if you allow me. Do you smoke? How is the support at home? Whom are you staying with? And how are things at home? How have you been feeling lately? Thanks for all this information, Mary. Do you feel that anything is important which I forgot and you wish to tell me? I would like to examine you now with your permission in the presence of a chaperone. I'll ask my nurse to see your pressures and your heart rate, And I'll be doing a gentle tummy examination to see how wound is healing. So is it okay with you? Now I'll break the news. So Mary, I can see that you are alone. Is there someone with you around? Do you want my staff to be with you? I have some important information to be provided. There is some important information to be provided to you. Mary, during operation, it was found that your left tube and ovary were perfectly normal, but right ovary had a 7 centimeter cyst, and the entire ovary with the right tube had turned on itself, stopping the blood supply to them and making them non-viable and dead. Are you with me, Mary? I'm so sorry to be telling you this, as these structures were dead. So tube and ovary of right side were removed during the operation. What, doctor? But I was told that only the cyst will be removed. How can you do that? Yes, I can see that this has come as a shock to you, Mary. Actually, right tube and ovary were totally damaged. And if left like this, they could have caused further problems to you in the form of infection. And since the tube was unhealthy, which means that if you get pregnant in future, there are high chances that pregnancy can occur in tube, which has its own serious implications. But doctor, why didn't they told me before the surgery that I may land up in this? Mary, actually these things are discussed before surgery. But what happened in your case needs to be investigated. Definitely, an incident reporting will be filed for this, and our risk management team will be looking into the matter where what went wrong. And definitely, the operating team will also come and debrief you about all this. I hope, doctor, this was just a cyst and not a cancer. Those scans and gross examination of cyst strongly suggest that it was an innocent growth, but definitive diagnosis, Mary, will be clear only after the cyst is studied in the lab, and the results will be discussed with you in a week's time. But how can I get pregnant with just one ovary? Yes, I understand. Let me assure you, Mary, that as you already know, your other tube and ovary were normal. So definitely, with this healthy ovary and tube, you can get pregnant, though the chances may be slightly reduced. But still, after discharging you from here, we can hook you up with a fertility specialist whom you can talk further about your fertility plans. When will I be discharged? Yes, Mary, since you are recovering well, we'll be discharging you in a day's time. But definitely there are some red flag signs which you should be aware of. In case you have fever, you have bleeding, discharge, any unusual pain, pain in the legs, difficulty in breathing, we'll be giving you 24/7 hospital number where you can contact us. And Mary, I can see that this has really come as a shock. If you wish, I can hook you up with the counselors as well. I'm so sorry to be telling you all this again, Mary. Anything else you want to know? Thanks for your time. Okay, Manikam, I hope this is clear, though you covered almost all the points, dear.
Thank you, ma'am.
Yeah. Any doubts, any one of you with the station? Any doubts, dears?
Hello, Dr.
So this is a,
Gitika.
yes. Who is this?
Dr. Gitika, I want to ask one question.
Yeah.
In debriefing scenarios like this in this station, we have to take whole history from the patient.
No need, dear. You just evaluate the case. This patient is in post of ward. You ask her about her recovery. This is very important. And this comes with
Okay,
communication with your role player domain. Okay. And your
okay,
information gathering. You have to ask her what were the events which led to this surgery and how is she recovering at present. Since she is already hospitalized, it is a better idea that you know about her BMI. If she is hale and hearty, she is recovering well, you can skip upon her blood group, you can skip upon her Genova status, and but definitely asking about support if she is developing any complication, or if she is you are debriefing her, then support becomes important to know who is there with her. So yes, few points in information gathering, they are important, but the rest of the points you can miss upon.
Okay, means targeted history need to be
Yeah,
asked now
targeted,
from the patient.
targeted.
Okay,
Yes, yes,
okay.
targeted
Thank you.
history.
Thank you, Dr. Deepika. Thank you.
Okay, okay, dear.
Thank you, Doctor.
Okay, I hope this case is clear to you all. Any other doubts? Okay, no doubts. Okay, fine. Those who joined late, this was a post-operative case which we have discussed, and it was debriefing. It is one of the very important recalls which has been coming recently. So you can just go through the recordings in case you have missed. So just telling you regarding our few courses which are coming. We are coming up with a regular course for the November candidates, where each candidate we we mainly only take the active participants who present the cases. Okay, so listeners we are mainly not taking, and in those sessions there will be 15 live sessions, and each candidate will be presenting 15 cases. You will be getting a Telegram group where you will be provided the support, and you will be given the recordings of all the sessions, plus all the books will be covered, and we the mentors, Dr. Rashmi and me, will be giving you feedbacks, and we try all the books, important books, plus we give you ready-made templates and some voice recordings as well. So in case you wish to join, you can contact Dr. Rashmi. This is her number. Plus, me and Dr. Rashmi, we take one-to-one stations also. In case in some of the stations, if you're not confident, you can contact us for one-to-one stations also. The charges, they are reasonable. And but this is mainly towards the end. Once you feel that you are not gaining confidence on one particular module or station, then you can join these. Otherwise, this is a regular course which is coming for November. So I hope the session was helpful to you all, and thanks so much for joining it. And any doubts you can ask us, and you can just give us a message. We are just a message away from you all. And keep practicing, keep studying, and try to speak as much as possible. To start with, you can start with doing 3 to 4 stations in a day. Just take up one particular module and start with all the recalls. Literature is available, endless literature is available on Google. So NHS sites give so much of reading material. There are patient information leaflets, guidelines, few guidelines, some key recommendations. Yes, they are important when it comes to structured discussion. Try to avoid using jargons, the medical terms, as much as possible. Try to use very simple language, and check the understanding of the role player when you are discussing in between. Keep all the 5 domains in your mind. That is information gathering, your communication with role player, communication with colleagues, patient safety points, and applied clinical knowledge. Read the station very meticulously and carefully. See what domains they have asked for, and then perform the station. You have to cover your station within 9 minutes, because most probably it is going to be an offline exam from now onwards, I think. So yes, you have to complete your station, because sitting time, getting up time, so that also takes your few seconds. So always try to keep a target of 9 minutes, 9 to max of 9 minutes 15 seconds. That is very, very important. Okay, so these are some important, and always keep those 5 domains. Just once you are communicating with the role player, just keep in mind, okay, I have covered my this domain, I have covered my this domain, so that you fetch marks in all the domains. So these are some of the important points which I wanted to tell you. Any doubts further, you can ask me. Otherwise, I'll end the session. Any doubt, dears? I hope the session was helpful. Those who have joined later can go through the recordings there.
Thank you, Dr. Geetika. It's a wonderful
Thank,
session. Thank you.
thank you so much.
Thank
Thank
you so much,
you.
ma'am.
Thank you, dears. Just go through the recording and this will be available, okay? We'll be providing you recording in the morning. Okay. Chalo. Take care. All the best. Keep studying. Good luck to all of you. Bye.